We are now streaming live, sir.
Okay, we're back live. We're going to continue the meeting according to the agenda. So we're on section 4 of the director's report, a PDMP update. Kelly, could you do that, please?
Sure. I just would like to bring to the attention that on May 12th, the Missouri legislature passed Senate Bill 63, which modifies provisions related to monitoring certain controlled substances. Basically, this established a statewide prescription drug monitoring program. As you are familiar with, Jefferson County participates in the St. Louis County PDMP, and we will continue to do so until the state prescription drug monitoring program is set up and running. So basically, there are several steps that are going to need to be taken into account as they're getting this set up, as well as they have to identify a vendor, they have to get things in order. As that process is going on, basically in our conversations with Dr. Khan and the St. Louis County PDMP, we will continue to provide those services within our county for our dispensers. So dispensers in Jefferson County should continue to report their Schedule 2 through 4 controlled substance dispensation, and we have already renewed our user agreement with St. Louis County until the till the statewide contract is available. So just updating you guys that even though that has come into effect, it may be a little bit longer as they are working through the process to get all the pieces together for the statewide PDMP. I'll keep you updated as we learn more. And then the final information, and I apologize for just a moment. I'm just going to hit on mute for a moment. I have to plug my computer in. Please forgive me for just a second.
Ask you a PDMP question, please.
Sure.
St. Louis County going to continue their program even after the state's startup, or are they going to stop?
I believe that once the statewide program becomes online, then it will roll St. Louis counties into it. But in the meantime, St. Louis County is continuing as the bridge in order to ensure those services continue. We have protocols in place and agreements with multiple states for information sharing. And so it is in the best interest to continue to keep that system alive until such time as the statewide system takes over.
Okay, thank you.
Mm-hmm. And hopefully I won't lose you. My computer is starting to go. The last thing I wanted to bring up was the concern regarding the Delta variant. The Delta variant is the newest variation of the coronavirus that is coming out. Missouri has just become the #1 state in the nation for cases per 100,000 residents, and Delta variant is playing a very large role in that. The World Health Organization and the Center for Disease Control have both considered the Delta variant as a variant of concern due to its more transmittable than the Alpha variant by up to 50%. And our preliminary data is suggesting that it is more virulent as well, causing more serious infections and higher rates of hospitalizations. Things that we are seeing currently within the state of Missouri, which give rise for concern, are the significant increase in cases within the Springfield, Joplin, Branson communities, as well as in the northern counties of Missouri. Basically, we have seen the hospitalizations have reached levels where they are looking at Cox Health out of Springfield to start diverting patients to the St. Louis and Kansas City areas. The difference with the number of individuals who are hospitalized is that they are seeing significant numbers of individuals in their 20s, 30s, and 40s with this strain who are being hospitalized rather than older adults. Right now, what they're looking at is the fact that this particular virus is having, it's seeking out those basically who are not immunized. So those who are immunized are showing better resistance to this than those who even may have had the disease and have recovered from it. So one of the things that they have found is, in particular with the Washington University study, is that though some individuals may show that they have longer term immunization and antibodies resulting from the having an earlier version of the coronavirus. Some of them are showing none. And so it is extremely important whether or not an individual has had the coronavirus to go ahead and to get the vaccine as protection against this particular variant with the speed and the transmissibility of it. As far as looking at what our concerns are, we've already seen a large increase in the Lincoln County area. Our concern is when the first coronavirus started spreading across the state of Missouri, it went along the pathways of the highways, the major cities. And so if you think about it in terms of people traveling, it will move city to city. A concern is if you look at Branson, Springfield, those are
Sorry? Her computer may have died power lines. She said that she had to plug it in.
We've got the letter there. Can you text her?
Not sure what else she was going to try to convey in her report, but obviously this Delta variant is a concern. I believe she said that Missouri leads the country in incidence of those cases. So certainly something we need to watch. And I think especially as we get into the fall and winter times of the year and how that could affect schools starting and unfortunately could affect a lot of other issues. So we don't get Kelly back.
She's gonna try to dial in on her phone.
Sorry.
She's gonna try to dial in on her phone.
Mr. Chairman, sir, is this open for discussion?
We're trying to get the opportunity for her to finish her report. Let's see if we can do that fairly quickly. There you are. Oh, can't hear you.
sorry.
Okay.
Okay, I'll make it short. I have a very big concern with the fact that both of the locations, Springfield and Branson, are tourist locations, and a lot of individuals within our area particularly frequent them for weekend destinations. And so definitely need to increase our push for vaccinations within the community. There are 4 sewer systems that are part of the sewer shed analysis with the state. 2 of our 4 have started showing the Delta variant as part of their analysis. Basically what they're saying is usually within about a month after that, you'll start to see the human cases with the Delta variant. I do know that a couple of our regional partners have started to see human Delta cases. So again, encouraging individuals, if you have not received your vaccination at this point, please do get your vaccination if you are able. Otherwise, please do utilize the prevention services or prevention methods in terms of wearing a mask, extra hand washing, and being very mindful of being in groups at this particular moment in time.
Okay. Any questions pertinent to Kelly's report, please?
Yes, I have a question, Mr. Chairman, and directed to Kelly with her report. You know, there's always going to be a variant of a virus in, our lifetime and in the country. They determined that the COVID, SARS-CoV-2, to be a pandemic. Okay, this particular variant that you're mentioning hasn't been determined that to be a pandemic. Number one. Number two, you're always asking people to get vaccinated, but we've had
A question?
we've had all of this out there, and people that want a vaccination have gotten it, and we're still looking at a good 40% more that don't
Question.
get vaccinated, we're not going to achieve a 70% vaccinated community. You're not going to make it happen, no matter what you do. People have
Davis,
Not ask the question.
Ms. Davis, you're out of order again.
that's going to bring herd immunity. It's not. We have herd immunity now because our numbers are low.
No.
No,
Do anything else, our numbers are low.
absolutely,
Single
absolutely
digit in the
incorrect.
hospitals, no deaths, in the yellow for
You know,
7
I-
weeks. We're at
very hesitant to say this, but you really don't know what you're talking about.
Oh,
So,
yes, I do.
Ms. Davis, one thing I would like to bring to your attention, Ms. Davis, you asked a question of me, or you said that you were. So, Ms. Davis, one thing that you have pointed out repeatedly is this is an 80+ virus. The individuals that we're seeing in the hospital at this moment in time are in their 20s, 30s, and 40s. We have a reported case of COVID in a 1-year-old. There's a 1-year-old in the hospital at this point in time. This virus can attack anyone. And so we must do what we can to ensure that everybody who can get immunized so that we can protect those who can't.
The immunizations are not foolproof. People are still getting COVID that have been vaccinated. The people actually are better off that haven't been vaccinated. They're not seeing this problem. And you're saying, give me some facts, give me some figures, show us as a board that there are some people that have not been vaccinated in numbers that we need to be concerned about for this
question,
new.
Ms. Davis, you're out of order. I'm going to warn you again. This is the last time. I'm going to remove you from the meeting if you don't stay within the rules of the meeting. So what are you going to do?
What do you want me to do, Dennis?
All right, let's move on. We have no old business. According to our amended agenda, we're going to go into a closed session.
I make a motion, we go into closed session, closed record, closed vote in relation to 610.021 subsections 1, 2, I believe 3 and 14, if I'm correct.
Second motion.
Okay, a motion and second to go into closed session. We need a roll call for that, please.
Actually, you need to ask if there's any discussion of anybody that does not want to go into closed session. And then ask for a vote.
Further.
Point of order, sir.
We have a roll call, please.
Mr. Deal,
Yes.
Point of order, sir.
Yes.
Mr. Prater,
Yes.
Mr. Pig,
Yes.
Ms. Davis.
No, point of order. I don't want to close the meeting.
We're closed.
It's not closing the meeting, we moved the closed session into before new business. We took those out of order. So we'll have a closed session, discuss the things that are listed there in your agenda, and then we'll go back into open session for new business.
Okay.
Nothing else on the agenda, so if you wanted to try to propose a different topic of discussion in the open session, you'd be out of order because it's not on the agenda.
I'm gonna wait in the lobby.
Okay.
You ready to stop it, sir?
Yes, so we're